this episode of Chamber Chats, we welcome Phil Lee, West Florida Market President for Florida Blue, the state's leading healthcare solutions company. Phil oversees business operations across a 14-county region, spanning from Hernando County to Collier County, including Greater Tampa-St. Petersburg, Sarasota-Manatee, and the Fort Myers-Naples area. During this podcast, Phil shares his expert insights on the evolving health insurance landscape, highlighting upcoming changes for open enrollment, the role and future of federal subsidies, and what both individuals and business owners need to know to find and maintain affordable coverage in Florida's shifting market. In this podcast, we'll explore what's different for this year's open enrollment period, why federal subsidies matter, and what happens after 2025. We'll explore how Florida Blue is helping individuals and businesses find more affordable coverage. We'll also cover broader trends and updates in Florida's health insurance market. Welcome, Phil.
Thank you, Christina. Delighted to be here.
Wonderful. It's so nice to have you.
Yeah.
So tell us a little bit about Florida Blue.
So Florida Blue, we're an 82-year-old company at this point, providing health and welfare strategies for Floridians. But we really had a transformation in our organization a little over 10 years ago when we formulated GuideWell. GuideWell is a parent company to a solution of businesses, Florida Blue being the largest. But we also have a number of distinct business units, including we're in the direct delivery of care, we're in the retail application, the analytics space. And I know we'll talk about that throughout the day. But our mission, maybe just to start there at Florida Blue, it's to help people and communities achieve better health. And so I'm so delighted and honored to be with you and your listeners today to share a little bit more about the marketplace and what's happening in the health insurance space.
Well, thank you so much. We're so happy to have you, and we're exploring all kinds of questions, right? Whether you're an individual seeking health insurance coverage or an employer wanting to make sure that your team has the very best.
Yep.
Want to ask some questions. Talk to us. What is different about open enrollment?
Yeah, so several different things. And also think it's clear, we got to be clear about how we want to segment the conversation. So open enrollment, probably the comments will flow for the Affordable Care Act, which is the marketplace for individuals in the under 65 space. And then I'll talk a little bit about the group dynamic as well, and there's some interrelation. So open enrollment, it will be, I will be honest, will be different this year.
Okay.
But for those of you who participate in health and health insurance in 2026, premiums will go up, and there's a couple of factors associated to that. The federal government, they oversee the marketplace, so the Affordable Care Act, the ACA, and they've instituted a few rule changes here for this upcoming open enrollment period, which starts on November 1st for anybody who's shopping for a plan in the individual space. Of note, the biggest change is today individuals receive enhanced subsidies, so they actually get premium tax credits, which helps lower both their premium and their out-of-pocket expense. Those enhanced subsidies were introduced in 2021 by then President Biden as part of the American Rescue Plan, the ARP. We love our acronyms in health. But as part of the Rescue Plan, it extended the subsidies that individuals received. And so we've had more people participate in the ACA across the country. Florida has always had a higher share of participants in the federal exchange relative to some other states. So those subsidies expire here at the end of 2025, and it will put pressure on individuals who we know are already struggling with their day-to-day, particularly in their journey of health. And we'll talk about, some solutions. So that's a big change. There's also some just changes in terms of income verification, which may invite or disinvite people from actually renewing or shopping into the federal exchange. And then some rules just around the time frame. For the last several years, coming out and through COVID, the period for actually electing insurance extended well beyond open enrollment. That window is now compressed. So consumers and Floridians will have less time to maybe shop and navigate through their insurance journey. But at Florida Blue, we're well prepared to be able to help them in that dynamic.
Oh, good. So to understand, all federal subsidies are going away for 2025.
Yeah, it's a great question, and not all federal subsidies. So, but the enhanced premium tax credits will be expiring. Individuals, if those, unless there's congressional action, will still receive subsidy based on their age and income. Today, just let me kind of paint a picture of what that means. So nationally, we have about 24 million people who are covered in the ACA. Here in Florida, we have about 4.8 million Floridians that participate in the ACA. Of that 4.8, over 4 million of those individuals receive those subsidies, those tax credits. They will still receive some. It's based on their percentage of their federal poverty level, the county that they live in and reside. But those enhanced credits, which have allowed individuals to participate over the last 4 years, will expire. So there will still be some subsidy. Today, most of the individuals that participate in the ACA are about less than 250% of the FPL, the federal poverty level. I know you and the Chamber and United Way do a lot of work in the ALICE population, so individuals who are really living paycheck to paycheck. Majority of those individuals are received through those enhanced tax credits. Their premium today may be $10 or less, depending on the plan and the product that they're in, and they will see an increase kind of across the board.
So will this affect all insurance companies in Florida?
It will. Anybody that shops and or renews a policy in the ACA will see their premiums increase, and this is beyond Florida Blue and beyond the state of Florida. So all participants in the ACA, unless those enhanced premium credits were extended, we'll expect to see increases in their plan today.
Okay. So what is Florida Blue doing to help people find more affordable coverage?
Yeah, we have a number of different ways. First, it goes to being local. We have to understand the needs of this community and really work hard to be able to support those needs. So we have local agents who can help an individual or their family be able to shop or renew and look at plans. Those individual agents are also specially trained to handle this upcoming open enrollment period to make sure that if that family or if that individual or family were to qualify for a subsidy, they're getting the absolute maximum that they could achieve. But how people engage is, we need to have different mediums and modalities. So we have agents that you can schedule appointments with for an in-person session. And I would suggest, doing that now, like talking to your broker agent, come and visit with us. We have a retail center in Estero that is full of navigators, sales and service professionals, but we also have nurses, we have social workers that can help families and whatever their journey of health may be. And then web and telephonic sales. So there's a lot of different ways to engage with us, but our teams are really, really centered locally. What are the dynamics here in Collier County that we can be responsive to? How can we help that individual, that working mother with their dependents, be able to find a plan that's going to be the best for them in their life, wherever they may be in their journey of health.
That's great. I value and appreciate that so much. Do you need an appointment at the Estero
You don't
location?
need an appointment, yeah. And you also don't need to have Florida Blue insurance. So these are the Estero Retail Center. It's for the community. It's a public center. Okay. In addition to sales and service, as I mentioned, we have clinicians. You can come in and get a biometric screening, take a personal health assessment, work with one of our health promotion coaches, whether that's in nutrition management. If you have a chronic disease, diabetes, we have specialized nurses that can help an individual navigate their condition. And we also just have a lot of fun. At our retail centers, it would not be uncommon to walk in and there may be 30 people that are participating in yoga or Tai Chi. I went into a group the other day and there was a collection of about 35 senior members that were all doing gardening and potting and just really, really having a sense of community. So they're open to the public. They're open after hours, for those individuals that are working from an 8 to 5 on the weekends. And so they are a community center and would be happy to have anybody come and engage with us, whether or not you have Florida Blue insurance.
I had no idea. Thank you for letting me know about that. Of course. So shifting gears when it comes to the business owner. So how are these subsidy changes going to affect the business owner and employer?
Yeah, I think we have to look at the conversation around health and healthcare. And again, the most important thing for all of us is, take kind of the current environment, the political maybe division that exists, put that on this side. having access to high quality, affordable healthcare should be universal, and it shouldn't be predicated on where you live or your socioeconomic status. And we firmly believe that at Florida Blue. If those enhanced subsidies were not extended, as we talked about, it would drive individuals to become uninsured. And I don't think anybody wants to put, our neighbors and our residents who today we know are struggling in their journey of health and providing more affordability into a situation where they're uninsured. It does have implications, though, to the business owner. You think about what does that mean for our hospital partners, for individuals that are showing up in the emergency department and who may have uncompensated care, but they are really sick and they need to be served. And we have great institution and partners in this community. It puts a greater strain on our first responders and our law enforcement officials. It magnifies and heightens the behavioral health epidemic that we're in. And so to a business owner, whether or not the ACA is a big part of that business owner or that business's plan or strategy, the implications from it do resonate in terms of the cost. You think about hospitals, they're not necessarily getting increases from Medicare Advantage or CMS. They haven't been able to get increases in the Medicaid. So they do look to commercial payers, Florida Blue and others, to help provide more affordable solutions. And so to that business owner, it does show up in his or her rates and renewals. Florida Blue, we're a different company. We really are a health solutions organization. We're a not-for-profit, so anything that we do is on behalf of our policyholders who are our members. And so we really look to kind of reinvest that back into our communities. But the ACA should be on every business owner's mind because it does have implications to Collier County. We want this community to continue to thrive and prosper and be vibrant and sustainable. And so if we think about generating economic wealth and the transfer of that, public health is a big part of the equation. And we should have thoughtful conversation about how to pay for healthcare and how to pay for health insurance. But it shouldn't be at the detriment of some of our most vulnerable, citizens. And so the more people we can provide a valued insurance solution to and for, the better this community will be.
I appreciate that. Yeah. Excellent. So what else is new in the insurance market that you think people should know about?
There's a lot happening in the insurance market. So, I think a couple of things specific to this community and the state of Florida. We have seen carriers pull out of Florida. They've announced that they're either withdrawing, either in a large concentration or wholly from the state of Florida. Florida Blue, we've been a part of the ACA in all 67 counties, in all product lines and levels since inception. And so we really see that as our role. It's to be able to support the needs of every individual, every family, and every community across the state. Those changes of having an insurer, participate, but then not extending or being here will cause some disruption. There's some exciting things that are happening, certainly inside of our organization. Everybody talks about the promise of AI and, what does artificial intelligence and other large language models mean in healthcare? And there is a lot of promise, Christina. Like there's a lot of things that I think we should all be excited about. We talk regularly as a team about, AI, while there's this kind of big macro promise, but it's also just providing more automated infrastructure. How do we be efficient in the tasks and jobs that, we're doing every single day? And we have great promises. This isn't a new dynamic for Florida Blue. We've been working in AI for a number of years. Maybe just to highlight an example or two. Prior authorization, I know is a pain point. I've dealt with it even in my own family. Nobody likes the prior authorization process, and so several years ago, we really looked as an organization, how could we improve that experience on behalf of our members, on behalf of our provider partners, and we were leveraging AI and have been over that period of time. If you think about services like knee, hip, spine, musculoskeletal conditions, where there's a lot of volumes of transactions, we've been leveraging AI to help automate the prior authorization process. Doesn't mean it's making decisions or
Sure.
changing the current process and protocols between clinicians, but it's just looking for efficiencies. In our business and in our organization, we've been able to take a prior authorization process, which may extend 10 to upwards of 14 days, and really compress that down to 19 to 90 seconds.
Oh my goodness.
Receiving information from the hospital or the clinician, matching that against the medical policy, getting it to appropriately to the right care and clinicians inside Florida Blue, making an appropriate determination. I think that's what all of us as consumers in healthcare expect. It's a greater experience. So there's, I'm excited. We're excited about, kind of new technologies and new innovations inside of healthcare. And then I just think the landscape is really, really dynamic and changing and transformative through several different partnerships. Going back to how do we support the needs, your question of what is Florida Blue doing and where do we see that opportunity? It's definitely in looking at this community and finding organizations that are working on behalf of the people they're here to serve. You think about the food insecurity needs that individuals might be struggling with. Nobody wakes up today and decides that today's the day that I'm food insecure or I can't provide for my family. So having a deep partnership with organizations like Harry Chapin and others who are providing not only food and helping individuals become more food secure, but also wrapping around other support services. And so we've really been intentional at Florida Blue around community development and partnerships, food insecurity, behavioral health, mental well-being, generational poverty. Like what does it actually take to kind of break the cycle of poverty that we know so many of our residents here may be experiencing? And we think a very prominent role that we play or can play in that is just organizing with other like-minded companies and nonprofits to expand our vision and reach. And so a lot of promise, and we're proud of the work we're doing here in Collier County, and we're only looking forward to growing that work here in this community.
Excellent, and we look forward to helping you do that here at the Chamber. You've said quite a few things, I think, that sets Florida Blue apart. Capture a few more things for us about what makes Florida Blue just so distinct and different. What makes you most proud of working for Florida Blue? Yeah,
so I've been at Florida Blue now almost 19 years, and I never thought I would work for a company, more than like 4 or 5 years. And I can honestly tell you, Christina, I couldn't be more excited about the journey that we're on as an organization. Healthcare is incredibly complex, and I recognize, and we recognize, that despite all of our best efforts, healthcare is still highly unaffordable, highly inaccessible. The experience is not dignified, it's disenfranchised, it's not empathetic, and that's what motivates us, and that's what motivates our Florida Blue team. Back to Estero, when you walk into the Estero retail center, you should ask, well, what is the mission of Florida Blue? And, a lot of organizations have their mission statement and their vision statement and their set of core values. But when you do that, and when you engage with our teams and our different staffs, they not only can cite the mission, but they can talk about what does that mean in the work that they're doing today? Or how are they impacting, that family? And so, to me, it's just this deep sense of pride, this deep sense of we want to continue to make a difference. And we know that people are struggling, and how we can find the right partners, how we can engage. We talk as a team. There's no amount of work that we do that's insignificant in the life of that mother, that child, that family, that business owner, that community. That means we have to really be localized in terms of our approach and our strategies and find the right ways to make a difference. And so really excited and proud of our organization. I mentioned GuideWell, and I think it's important for your listeners to understand our reach. We're deeply committed to the state of Florida, and we are local. We live here. Our kids go to school here. We're participants in this community, so we want this community to thrive. GuideWell has allowed us to extend and expand our reach, and so we support customers all over the country, including in Puerto Rico and the U.S. Virgin Isles and in the Caribbean. Last year, we served 38 million people under GuideWell, and we're growing. And so we need to continue to evolve who we are, not just as an organization, but who we are as an industry. Our healthcare models need to continue to evolve. We need to look for greater innovations, more affordable models of care. And I think that's what really, excites me and why I love working for this company now, almost 19 years later.
That's incredible. Well, you're taking care of the whole person, which I love, right?
Yeah.
And health is wealth, right? And I mean, we just know how much of an impact it has. We had an opportunity recently to do a ribbon cutting with you in a space that's new to Southwest Florida.
Yeah.
Talk a little bit about that model.
Yeah, thank you for that. Yeah, how we think we can help individuals is providing greater affordability and access. And one of the things that we've done as an organization is to really stand behind that. We opened, and thank you to you and the Chamber and all of your supporters, our Florida Blue Sanitas Medical Clinic. These are advanced primary care clinics that are really focused, and you mentioned holistic health, the whole person approach. We opened our Sanitas Medical Clinic here in this community. We actually have two here in the broader Naples, Collier area, one on Collier Boulevard and the other one on Airport Perrin Road. And it's a different service model. And this community, we're blessed with fantastic primary care providers. But what I have heard from this community is getting an appointment, getting access to see a clinician, or if you have an appointment, you may never see the doctor. And we want to have something different, at least an alternative for individuals. So we opened our Sanitas Medical Clinic, really centered on the whole person, the family, the story of Sanitas, which I know I shared at the opening, but just to share with your listeners, Pat Garrity, who's our president and CEO, at the same time we were transforming our organization, Florida Blue and GuideWell, he saw an opportunity to take an even greater reach into the advanced primary care space. We partnered with a company called Cole Sanitas. Sanitas is, at that point in time, not based in the U.S. They're not based in the U.S., but they were looking to open and establish a U.S. presence. They're based out of Bogota, Colombia. And across the world, Sanitas is a primary care provider, a teaching hospital, a large foundation, but they wanted to have a U.S. presence. And Pat saw the opportunity to partner with Sanitas. We opened initially 9 clinics in South Florida, so in the Miami-Dade and kind of up the coast area. This was pre-Affordable Care Act, so pre-ACA. You can imagine, opening new clinics with no patients, no distribution channels, and serving that community. Today, we have nearly 70 clinics across the state of Florida.
Wow.
Last year, we supported 535,000 Florida Blue members. Sanitas is an exclusive primary care provider of Florida Blue. So they only see our members and patients, and we take pride in that because we want to deliver a different experience. So we're excited to have not only the 2 here, but we've opened other Sanitas clinics up the coast here in Southwest Florida, and are looking to continue to expand access to high quality, affordable primary care in this market.
Excellent. Well, it's a beautiful, welcoming space.
Thank you.
So we're really excited to have it.
Yeah.
Is there anything we haven't talked about, Phil, you want to make sure our listeners hear?
Yeah, I think just, back to the question for the business owner and the stakeholders. You think about the state of Florida, we are largely a small business makeup of our state. I think that makes us great. I think the dynamic here, I didn't talk about what does it necessarily mean, the ACA to small business owners, but I think it's important for your listeners. A number of employers who are under 50 employees today either provide benefits for their workforce or may have a defined contribution strategy across the country. And as a part of those enhanced subsidies and some of the measures in the ACA today, there has been a tremendous growth of small businesses in the Affordable Care Act. And, that will put a number of our local businesses, it could put them at risk. And so we're concerned about that. And I think as a business owner, again, back to how can Florida Blue help and support you, we would love to have conversations around whatever that business owner's health and welfare strategy may be. And just to put kind of a finer point on, if those enhanced subsidies were to go away, what does that really mean? If I'm, a family of 4 living in this community, with maybe an average, income of about $130,000. And I participate in the ACA, I could see premium increase of over $12,000 next year.
Wow.
113% increase. For a couple who's in their 60s, with about $80,000 of joint income, it could be upwards of $21,000. That's not Florida Blue. That's across this industry. So it does impact families. It does impact businesses, and I think the more we can do as a community to certainly educate, guide, navigate, but also advocate is important. And I think this community is a wonderful community. The way that Collier comes around some very difficult problems and is not shy to take those on. And thank you to you and for your leadership and the chamber as well. But it is, and I think it is a time in our country where leadership really matters and coming together really matters. And I think the more that we can look for opportunities to bridge and build versus get further apart, particularly on behalf of the people we're all here to serve, the better this community will be. And so, really proud of Florida Blue and our ability to engage with multiple stakeholders around our mission. And if it can help people and communities achieve better health, and we can do that here, we know we can take it to another level. So really excited about the work that we're doing in this community, greater opportunities to make an impact, and look forward. And I want to say thank you to you and to the Chamber for the partnership and all the work that you do on behalf of your investors and your businesses that you support.
Well, thank you so much, Phil. I have learned so much, and I hope our viewers have as well. Sounds like some fantastic opportunities for you to get access, have your questions answered. Thank you for telling us about the Estero location and the ability to just come in there, get your questions answered. And so if you haven't taken the opportunity to explore and revisit, I hope some of this was very helpful as you navigate as an employer, trying to provide the access for your employees, make sure we have a wellness around those that we care about, those that we work with every day.
Yeah, thank you so much.
So I just want to say thank you to you for your investment in our community and our organization and the work that we do. And thank you so much to Florida Blue.
Thank you, Christina.
Thank you again to our guests for joining us and for sharing their insights on today's episode of Chamber Chats. If you're interested in sharing your own story and you would like to be featured on a future episode of the podcast, we'd love to hear from you. Reach out to the Greater Naples Chamber to learn more about how to get involved. Thanks for listening, and we'll see you next time on Chamber Chats.